Balls Deep.
Welcome to Balls Deep, a humorous yet informative medical show with a mission of optimizing your performance in the bedroom, the bathroom, and the boardroom. I'm your host, Dr. Joe Pazona, a board-certified urologist and CEO of Pazona MD. We hope you enjoy. Now, let's jump right in. Hi, I'm Joe Pazona, and thank you for joining us today on Balls Deep. I am joined today by my lovely co-host, Miss Kat Williams.
That's right.
Kat, how are you doing today?
Ooh, I'm good. It's Girl Scout cookie season, so I am feeling nice.
Ooh, those are tasty.
I've had too many, I'm going to be honest with you.
That's okay. You got to have a little splurge every now and then, right?
Gotta live.
Absolutely.
So, Dr. Pazona, what are we talking about today?
So we're going to talk about what is urologist?
That is a good question. Can I be completely honest with you?
Yes.
The day that we met, you told me you were a urologist.
Mm-hmm.
My dad's an OBGYN in practice for over 45 years. I have no idea what a urologist is or what a urologist does.
That's okay.
No clue.
I didn't know either when I went to medical school, so I'm really excited to share with everyone what I do on a daily basis.
Perfect. I think a lot of people need to know what this is.
Awesome. Well, for those of you who are short on time, we like to start each show with the Cliff Notes version in a little segment we like to call
Just the Tip.
Kat, what are we learning today?
Number 1, urologists treat medical conditions of the male junk and the urinary tract in men and women. Number 2, a urologist is not a butt doctor. I found this out the hard way. Or the doctor you see for kidney failure. Number 3, a urologist should be focused on your overall health.
There's some good stuff here.
Absolutely.
Well, I think it's time now. What about you?
Oh, yeah.
How about we go
Balls Deep.
You see, we're going to have fun on this show, folks. So
tell us more about what a urologist is and what a urologist does.
Yeah, so the PG version is that as a urologist, we treat the male genitalia, aka the junk, as well as the urinary tract in both men and women. So some common conditions that people might know of: urinary tract infections, kidney stones, if you have any troubles going potty at any age, troubles in the bedroom. And then we also treat some serious conditions like prostate cancer, kidney cancer, and bladder cancer. So although most people think it's a very narrow field, we actually see a wide variety of conditions over many stages of life.
Okay. Wow. That's a lot more. I really only connected a urologist with dealing with going TT. So that's kind of stupid. So there's a lot more to it.
Yeah, I mean, absolutely. I mean, and like I said, I didn't even know what a urologist was when I went to medical school. So I found out and was like, oh, okay, this isn't so weird looking at balls all day. Like we actually, do some pretty neat stuff.
But why this as a specialty for you? What draws you to urology?
Well, I mean, the answer should be pretty obvious. It's because I love balls.
Okay, that's weird, and it makes me kind of uncomfortable. Is that true? That can't be
No,
true.
No. Listen, y'all got to deal with something that someone else finds gross in medical school. But, the short version is, I help people in the bedroom and the bathroom. And when you do that, they are really grateful. And we know how important those things are for someone's quality of life. When I was in medical school, we rotated on other specialties, and I was doing surgery and thought it was fascinating. But I was like, there's just something missing. These people don't seem happy. And then one day I was in the operating room. A urologist called me in, and this guy was like in his 60s, doing this for 30 years. And he plucked out a kidney stone, a very minor procedure we do. And he had the biggest smile on his face, was jumping up and down. And I said to myself, I want to be that guy. If he is this happy after 30 years, these are my people. And I honestly have zero regrets and can't imagine really doing anything else.
Okay, I love it. I love it. All right, let's move on to number 2. And I think, if I recall correctly, on that night I first met you, I asked a lot of truly tasteless and inappropriate questions about you, particularly, possibly being a butt doctor, which a urologist is not.
Yes, I can confirm that is a true statement.
It was bad.
But you're not alone. A lot of people do come to me or go, "Oh, you're a proctologist." Note for everybody, there's really no such thing as a proctologist. A urologist only uses the back door as an entry to feel the prostate. We are not butt doctors. So if you have any issues with your colon, things like hemorrhoids, you should really see either a colorectal surgeon or a GI specialist. But we don't really go back there for the most part.
I love that you use the phrase back door. So tactful. And you don't deal with anything with kidney failure.
Yeah, yes and no. So there are 2 kidney specialists. As a urologist, you can really think of this as the plumbers of the human body. When there's a blockage, you would come and see us. And some blockages can get severe enough that you actually go into kidney failure. So in that case, yes, you'd need a urologist. But the larger percentage of people who go into kidney failure when the kidneys don't work, they actually need a nephrologist. So we're the plumbers. They're the HVAC people. They do the filtration and the getting rid of toxins from the body. And so when you have medical conditions like diabetes, high blood pressure, things like that, you want to see a nephrology doctor. And so subtle difference, but very big difference in terms of our training and sort of the conditions that we actually treat.
Now, I've heard you say this before. You say this all the time, that you're actually just a plumber. Mm-hmm. You're just a plumber. So what does that mean?
Well, I mean, if we really break down the anatomy of both the urinary tract as well as performance in the bedroom, I mean, it's all about getting pipes flowing. So a kidney stone is going to cause a blockage in the urinary system, cause a backup of urine, which leads to severe pain. So the plumbing system is blocked there. Men with an enlarged prostate, again, a blockage because of a swollen prostate, a man is having trouble urinating. In women, there we have a leak in the system. So we're not blocked, we have a leaky pipe. And thus incontinence comes into play, which for the record, no woman should ever suffer with. So little plug for the ladies, please don't suffer with any bladder leakage. It's never normal. Just like you'd never tolerate any leakage of your pipes in the kitchen.
I think that's a preview of a future episode, because I think a lot of people are not aware that there are things to do for that bladder leakage, but that's for the future. The last thing we mentioned is that a urologist is supposed to be focused on your overall health, but isn't every doctor supposed to be focused on your overall health? Why is a urologist different?
You bring up an excellent point. And the sad truth about our healthcare system is that we're really good at sick care. We're not about healthcare. And unfortunately, we just tend to take a number of symptoms, we group them together, we label them as a disease or a diagnosis code on some chart, and then we prescribe a medication. But if you look at almost every single condition that we treat as urologists, you can bring them back to a root cause that is in wellness or lack thereof. So let's talk about erectile dysfunction. The most common reason that a man has trouble with erections is poor blood flow to the penis. Where does that poor blood flow occur from? Why does that happen? Diabetes, high blood pressure, obesity, smoking, all of these things lead to atherosclerosis or hardening of the arteries. So again, back to that plumber analogy. Here, the pipes are blocked because of plaque and scar tissue. So yeah, I can give a guy Viagra or Cialis, or my partner can put in a penile prosthesis to get a guy sexually active whenever he wants. But if we don't deal with the root causes of the problems, we're just putting on Band-Aids. Some other medical conditions, prostate cancer has very few risk factors outside of obesity. We know that lots of bladder infections happen when you have uncontrolled diabetes. Obesity is linked to things like bladder leakage. And so I can go on and on for hours going into the pathophysiology, AKA fancy doctor term for why do these things happen? And it's because of wellness. So we really feel at Pazona MD that we've got to talk to our patients about their diet, their exercise, their sleep, and their stress management. Because if we're not doing that, we're really not solving any of these problems.
And the pills are just a mask.
They are. Now listen, they've got their time and place, and
Sure.
we're not going to snap our fingers and get someone fit and reverse that atherosclerosis. So yes, that Viagra or Cialis can be a game changer for that man and his partner for being sexually active, but we have to start moving away from sick care and moving more towards healthcare. And that's why I'm a big believer in looking at these pillars of wellness, which we'll get into at a later episode, to really help treat all these urologic conditions.
Absolutely. I feel like kind of most doctors should be jumping on this well care as well, but we're still living in the days of doctors being concerned about sick care, like you say.
Well, sadly, we're not incentivized. And again, I think there's going to be a future episode here that we can go into in terms of the ills of our U.S. healthcare system. But there's just no incentive. Primary care doctors in a very short visit have to cover an entire list of medical conditions. They don't get paid for being thorough. They get paid for their timeliness. And as urologists, we're surgeons, and, our incentives are aligned to do more stuff to people. It's not to sit down with them and talk to them about their diabetes. It's much easier to just give them an antibiotic for their infection, give them a pill for their urinary issues we think are due to their prostate, but not spend any time on this prevention. And so it's something that I'm passionate about, and we've got to find a balance. But clearly we're letting people down when we don't have these conversations.
I agree. I love that you're into the overall wellness, overall health of your patients. Well, Dr. Pazona, this has all been great. Do you have a final thought? Do you want to wrap things up?
Yeah. So, again, a urologist, if we just think of as the plumber, that we are surgeons and we can fix things, but yet a surgeon should be also focused on overall wellness. I think that's what I want our listeners to take away from this episode. And, another thing that people need to be aware of is that we're really facing a crisis of physician shortage in this country. And in terms of urologists specifically, we're going to be short several thousand urologists in the upcoming years. We're the second oldest specialty in this country, so people are retiring young. 60% of U.S. counties don't have a urologist. So,
Really?
Yeah. So most 90% of urologists coming out of training are going to major mid-sized markets. They want to join big groups. They want a good quality of life. And, rural America is really going to suffer here. So
there are huge portions of the country that are never going to have an in-person urologist in any kind of a close distance to them. Is that really true?
100%. We only graduate 300 urologists a year. So, I want people leaving this episode understanding not only what a urologist does, but understand that there aren't a lot of us that are going to be around here in several years. And so I'm excited with what we're doing to come up with creative solutions to these problems. But we have to come up with ways to deliver this care. And it starts with, I think, great patient education. That's why we're doing this show, is we want people to get access to urologists, whether you live here in Nashville or whether you're several thousand miles away.
Well, that's fantastic. Well, thanks for doing this.
Yes.
This was fun.
Yeah, absolutely. Kat, any final thoughts from you?
Oh, from me? Get out there and get a couple boxes of Girl Scout cookies. Those girls are cute, and those cookies don't last. Not at our house, at least. Oops.
I'm not sure that's in line with wellness.
It's not. It's not at all, but it's once a year.
Fair enough. Tis the season. You got to have treats.
You got to live.
Absolutely. So to everyone out there, thank you for joining us on our first episode of Balls Deep. And until next time, please show yourself some love and grace. We're all works in progress. And setbacks are just opportunities to grow stronger. Thanks and have a great day.
Thank you for listening to this week's episode of Balls Deep. If you'd like to join our stream team of listeners, please click the subscribe button on your favorite podcast platform. For more information about our practice, Pazona MD, please visit pazonamd.com. This podcast is for informational purposes only, and the content is not intended to be a substitute for professional medical advice. The show does not constitute the practice of medicine. No doctor-patient relationship is formed through this podcast or any of the social media channels related to this show. The use of this information is at the user's own risk. Users should not disregard or delay in obtaining medical advice from any medical condition they have, and they should seek the assistance of their healthcare professionals for any such conditions.